Lung illness will pick up some commonly one. Will pick up some commonly one. Commonly happens in the case. So basically, in this part, we're talking about the full illness for the case. First one, common cold. Yeah, first one, common cold. Then we're talking about cough. Then asthma. Then we're talking about pneumonia. Certainly, case lung disorder may more than these four illnesses, but we're talking about some commonly one and generally required by CTCMA. So then let's go to the first one. First one is common cold. Yeah, first one is common cold. So common cold look like everybody pretty familiar with. Yeah, pretty familiar with. And a pretty common illness. So common cold in Chinese we also call 感冒. 感冒. So in your board exam, they will give you both names, English name and the Chinese pinyin name. They will give you both. So 感冒 is a pretty common illness in the lung system. Lot of lung illness, they start from common cold. And later on, they will develop to other illness. And this illness mainly is attacking by external pathogen. External pathogen, we're talking about wind invading. But the wind coming, attacking the body, usually is not itself. They may carry wind cold. They may carry wind heat. So they carry other pathogens going. And the clinical symptoms. Basically, fever and chill same time, like EPI attacking. Nose congestions and discharging happens same time. And the patient sneezing and maybe cough. So that's common cold. Yeah, common cold. So in TCM, we including generally common cold or maybe seasonally common cold, like especially in the winter and the spring season, people got common cold. And also influenza. Influenza still like infections coming from external. So we including both in the category under the 感冒 in TCM. So seasonal common cold, seasonal common cold, still by external pathogens, 6 pathogens externally. But it usually is not epidemic, means not a lot of people getting sick at the same time. But influenza, influenza, it truly is the conditionally relationship with seasonality and epidemic. Like in the winter or springtime, lot of people got influenza at the same time. So that's the difference. Yeah, that's the difference. And the common cold, yeah, not seasonally common cold, can happen in any of the seasons. Yeah, so that's the difference. But under TCM category, we're including all of these gamma. So for Western medicine aspect, that's mainly virus infections. So for virus infections, most illness we don't have like a powerful medication to treat it. Like bacterial, we have pretty stronger antibiotics can working very well. But virus, most viruses, we don't have like medication can treat it. So how the common cold? Basically by our immunity system defending functions and then our body cure itself. So for TCM aspect, we're talking about what's caused the common cold. So common cold in children, that's coming from external passenger evading. That's the wind. We say wind itself not only cause problems, they also carry other passengers like wind cold and wind heat, and even with summer heat, and maybe with some dampness and dryness. So that's why say wind cause 100 different kind of problems. Means they bring other passengers go in. And we say also influenza for TCM still belong to gamma, yes, seasonal epidemic kind of pathogen. Then we talking about what's specially for children if they got common cold. Yeah. So we are in the pediatric class. Basically, we just try to talking about something specially for children. So for children, for kids, their body 正气 is different. It's different because their organ not totally development yet. Like we talking about last week, lung not totally developed yet, spleen not totally developed yet. So dominate all our body 正气. That's the organ relationship. These two organs not totally developed yet. That causes generally qi deficiency. So including defending qi, including defending qi. So protected of ourselves, 门类 is the defending qi. 门类 is the defending qi. So lung not totally developed yet, spleen not totally developed yet. So that's the cause body 正气 deficiency or healthy qi deficiency. So that means body 正气 couldn't totally or properly protected bodies, especially 胃气 deficiency. Passenger easily evaded. So that's why the small case, pretty easily got common cold compared with adults. Especially when kids 6 years under 6 years old, that pretty easily got sick or illness, and a pretty common illness is common cold. Then we're talking about the symptoms and the signs, like we see the videos. So pretty similar like adults. Yeah, pretty similar like adults. Fever, aversion to cold. So we are talking about patterns in the cold first. In the cold first. Symptoms and the signs in the cold. So fever, aversion to cold, same time. Usually no sweating. And headache. And nose congestions. With thin, clear kind of nose discharging. And will be sneezing. And maybe cough. So that's the general symptoms. Yeah, general symptoms. Usually salt air without red salt. We compare with other patterns later. And the tongue, tongue, tail red, basically pretty similar like the normal tongue. Yeah, normal tongue for kids still kind of pale red or pink sometimes we say. Yeah, let it be red or pink. So thin and white coating. So EPI condition usually they are not affected of tongue or coating, at least from the beginning stage. Later on, when they moving deeply to internally, maybe changing to something. But from the beginning stage, they are not changing tongue. Pulse is floating or maybe floating under tight. So floating pulse relationship with EPI, external passenger evading. So 肺 defending T, 胃 T, fighting with the passenger in the superficial level. So that's why pulse is floating. Tight pulse is coming from cold. Cold blocking the channels. So that's the general symptoms and the signs. So treatment principle, treatment principle still same like adults. Dispersing wind, relieve the external. And the points, the points, like last week we talking about lice needles for case, tape lifetime, and we use short needles, thinner and short needles, and the lice stimulations, but we still can use needles. Or maybe we use acupuncture instead of needles. But generally say some points, some points. Gallbladder 20, that's the wind points. LI4, yeah, relieve external good points, and also common points for the high. 214, relieve external. So personally, I like to use 214. So for heat condition, like a wind heat attack. But truly, these points we also can use for relief wind cold. This external condition. Bladder 12 is the wind points. So that's the both wind points. And we're talking about for kids. Their lung qi not totally development. Their Wei qi difference. So that's why we put the backdrop of the lung in here. So that's a little bit different for adults. So we say for adults is external passenger evading. We try to relieve external passenger first. Then we do some codify, some difference in it. But for case, we say their lung not totally development yet. So that's we need the same time codify lung qi, codify lung qi. So we still could go to like a fundamental points of the lung, like a lung 1 or 元少数 points of the lung 9 to codify lung. But remember, for the case, their body is pretty small. Their skin is pretty thinner. We say danger points may be more dangerous for the case. So that's why we are not commonly go to lung 1 for case. And the lung 9, the similar is not that dangerous point, but close to blood vessels. And the case, the hand is pretty smaller and pretty thinner. So that's still not that commonly used. But if you do the needles, quickly go in, quickly withdraw it, still okay. Still okay. But be careful. So drainage means reducing. Drainage means reducing. So most points we need reducing. But bladder 13 we still need to tonify. The other points we relieve in the cold condition, we reducing it and keep short time. We say keep about 5 minutes. So that's for adults. We talk about keep needle about 20 to 30 minutes. But for the case, we only keep about 5 minutes. Or maybe we give some stronger stimulation and then don't keep the needle there. Just insert the needles, stronger stimulation needles, then withdraw it. So that's basically for case conditions, for small children. And with cold is acute problems. For acute problems, we try to treat it with like a continually treat. It's better twice a day. And 4 times as 1 section. Then we can like have a break for case after 2 days if still not relieved. Then we can do it again. Stronger stimulation for the case is just as much as they can handle. That's what we're talking about. And also depending the point. Like points on the back, they may can handle more. Points on the hand, they handle less. just to see how much case they can handle. So that's basically in China. Yeah, basically in China.
Jane,
People, yeah, go ahead.
sorry, what does that mean that it says with 4 times as one treatment course?
So that's like today we do morning and afternoon, that's 2 times. And tomorrow we do morning again, that's the 3rd time. And afternoon again, that's the 4th time. Then have a break, yeah, like 1 to 2 days. So we say kids problems, small children problems, they development pretty faster, they recover pretty faster. So most cases after 4 treatment, 4 times treatment, they may totally recover. Yeah, they may totally recover. If not recovered, after 1 to 2 days, we repeatedly to do it again. So 1 in the morning, 1 in the afternoon, and another time morning and afternoon. So that's together 4 times. That's we say 1 treatment course. Yeah, sounds good. So truly, that's truly like we talking about here happens in China. People pretty easily got acupuncture treatment. But in here, yeah, in here maybe especially for kids, I don't see too many kids they go to acupuncture treatment. But thinking about acupressure instead of needle, so that means you still can do twice a day. Yeah, you still can do twice a day. And still 4 times, and then to see how the case recovered. If not recovered, you can repeatedly do it. So remember for case, we always can use acupressure instead of needles. And we also can use electrical machine instead of needle. Yeah. So that's for the case. Some questions? So that's for the first pattern. We're talking about link code. And we also can use maxa. Okay, we also can use maxa. So that's still a little bit special for case. Yeah, that's still likely special for case. For audios, for EPI reading, we are not that commonly use maxa because we say relieve external first and then we do some tonify. But for case, yeah, for case, we can use maxa with acupressure with needles same time. So basically, still pretty similar points, but stomach 36 is a pretty good point for tonify. So while 2 maxa, so that means kind of directly maxa here. We put a small maxa over the skin. But be careful, yeah, be careful. Don't burning the skin. Case skin pretty thinner, yeah, pretty thinner. Or maybe you just use indirectly maxa. So like some indirect maxa and put maxa close to point about 5 to 10 minutes, and the skin kind of warm, then remove it. So still 4 times as a treatment courses or sections. So that's massage. Also we're talking about guasa and cupping before. Relieve externals still good way. But remember, when we're talking about cupping, when we're talking about guasa, they pretty easily make a mark, especially for the case. We must be careful. Okay? We must be careful. But truly, that's the way we can relieve external. But be careful. Be careful. Tell clearly for what will be happens. Or maybe I prefer Pina. I prefer Pina instead of Guasa. That way we are not truly make a mark. So that's more safety way. So that's wind cold part. Then we moving for wind heat part. So wind heat still EPI evading. Generally say wind heat evading cause little bit more heat, maybe severe kind of fever, but still aversion to wind. Yes, still aversion to wind, not aversion to heat. Aversion to wind, sometimes still aversion to cold. And maybe little bit sweating. Other symptoms, still headache and nose congestion, but discharging is more tuberous, not like a wind cold evading, it's more watery discharging. And the patient may be sneezing, maybe still cough, but when they cough, may some yellow kind of phlegm coming out, or maybe still white color, but mostly heat. Not like a wind cold. Wind cold is more thin, watery kind of discharging phlegm. So in this kind of case, if we see the salt air, so they may have some red in there and swollen in there, and also some pencil in there. So severe kind of case, maybe the kids don't like to eat, don't like to eat because when they eat it, they feel salt there. And the mouth is more dry, and the patient will be thirsty. So the tongue is little bit red, yeah, little bit red, but still first couple days is not truly red. After 2 or 3 days, maybe tend to tongue body little bit red, and could be have little bit thin yellow coating. So that the external heat can cause some thin yellow coating. If a thicker kind of yellow coating, that's usually coming from internal heat. And floating rapid pulse. Certainly, floating is external disorder. Rapid pulse is heat. So that's wind heat pattern. Yeah, wind heat pattern. So treatment principle for this pattern: dispersing wind, clear heat, relieve external. Yeah. That's still the same like adults. So the points, points. When we thinking about acupuncture, we same time we can think about acupuncture. 214, we say that's pretty good points to clear heat and relieve external. Li11, clear heat points. So generally speaking, Li11 mainly clear internal heat. So that means from start stage, we are not necessarily go to there. But later on, when heat more go to deeper of the body, some internal heat symptoms show up, we can go to there. And the Sanjiao 5 relieve external, Li4 relieve external. Lung 11, lung 11, 经腰 points of the lung. We know 经腰 points, we are pretty easily to clear heat. And also we can use bleeding technique for 经腰 points. But will cause the painful in there, maybe cause the small case crying because we use that point or bleeding that point. But truly that's clear heat. And also they benefit the throat. Relieve painful situation in the throat. Not only lung 11, lung 10 also. So patient health also, you can go to either one, lung 11 or lung 10. So still mainly reducing technique and still keep needles about 5 minutes. Or maybe just put the needle in and stimulation there and then without needles. So for sometimes patient more headache, we can use 太阳 acupoise and stomach aid to stop headache. So we still follow treat once or twice a day with 4 times as one session of courses. So if you we treat twice a day, that's basically 2 days as one courses of section. If we treat once every day, so that's basically 4 days as a courses or sections. Then we got a break, couple days, 1 to 2 days, 1 to 2 days, and then we continue for another section. So most of the case will recover after one section or one course. But truly, if some case is so different and are not totally recovered, we can use another section. So that's the wind heat part. So basically, common cold case mainly we have 2 parts. One is wind cold, one is wind heat. So basically for the case, we're talking about some prevention. Case weight is so different, so easily cause the common cold. So we need to do some prevention. So basically, we say if we know some case, they have the same problem like the common cold. Try not to bring our case go to that area. or even some public area, like the shopping store or public traffic. So lots of people go to there, especially during common cold epidemic kind of season. And also we can think about right now, COVID-19 infection. So COVID-19 by TCM, still in the category of 感冒, but it belongs to epidemic kind of 感冒. It's more severe kind of condition, pretty similar like influenza, but more severe with influenza. So we need more be careful. Yeah, try not to bring the kids. Go to public area. Go to lot of people's area. So that's the one thing we talk about prevention for the kids. And we can use some vinegars to disinfect the air to preventing the influenza, especially in the epidemic season. Same idea right now. So COVID-19 infections. So we say fumigate. It's like a steam. It's like steam. Put a container there. Put some vinegar inside. And you can put an electrical heater here. Like make a boiling it or steam it. And the vinegar will go to the air. So vinegar has some functions, disinfected air. But remember, when you steam the vinegar there, you need to carry the case away from the room. Otherwise, the vinegar will go to their lungs. Not a good idea. So that's talking about how much putting there. So until it's totally dry. So that's some prevention. That's some prevention there. Once a day for 3 to 5 days. And when you steam for the vinegar, keep the door and the window closed, but carry the case away from you. And some other nurse care. Keep the children warm and give some warm water. So when they have fever, especially, truly when kids get fever, they will get sweating. They will losing body fluid. So give them some warming water and cover the children with blanket. So don't think about when kids fever, take off all the clothes. So keep the warm and preventing some sweating. Thus easily relieve EPI. So we say for TCM, We need to have way for passenger go away. For example, some people try to store something in your home. You need to open the door or window, let it go. Don't holding them in your room. So passenger safety. So EPI condition. What's the good way? Let it go. Through the sweating. Especially later on when you learn the herbs. We have special herb category. Relieve superficial conditions by promote sweating. Promote sweating. And other nurse care. Other nurse care. So be careful. We're talking about the kids have troubles. They changing pretty fast. So we be careful to looking any changes for the illness condition. And for the case, they have fever. They have high fever. Pretty easily cause the convulsions. So that's we say we try to reducing body temperature when body temperature is too high. So generally speaking, fever is a body helping or some protective function in there, helping our body relieve passenger. So generally say if not high fever, especially for adults, we try not to use special kind of medication to reducing body temperature because that's the way we relieve passenger. But for kids pretty easily got convulsion from the fever. So when their body temperature like over 38 degrees, we need try to reduce some body temperature. But we still try to use physical way first, like put some cold water towel on the head, or maybe use some warming water, washing the hand and washing the skin, the body part. But if truly the body temperature over 39 degrees and couldn't reduce it by the physical way, maybe need some medication. Otherwise, maybe cause the patient like convulsion and also maybe damage some brain function. So that's need to be careful. We need watching for the patient.